How can you make incontinence products more attractive? Hey guys, it's Dr. Robert Chan here. One of the things about urinary leakage and incontinence that patients have to deal with is that men and women don't feel very sexy when they wear a diaper. That's why I was really excited to come across this luxury leak-proof underwear that's designed by a urologist, Dr. Jessica Lubahn. In this episode, I'm gonna sit down and talk with her about how she came up with this idea and what some of the benefits of using this leak-proof underwear called ONDRwear.
So the purpose of my company was twofold. One, to make really great products that could, and then really great products that could serve the function. So, someone who's not ready to wear diapers or pads has an alternative option. And then also to work by breaking down the stigma of incontinence. Incontinence is so common that, especially that I see, I'm at a point in my life, I see it among my friends, and I feel that I'm in a unique position that I can laugh about it with most people. So people talk to me about it a lot. And so I feel like if more people knew how common it was, how it just makes it more humanizing, right? And it makes it a little bit less of a deal if you can laugh about it or realize how common and that you're not alone in this, especially when you're maybe a 25-year-old mom not ready for pads, that you're not alone and there are options to treat it and you don't have to suffer through it, right? And so looking at what the period world has done in destigmatizing periods, back when I was learning and going through that myself, you wouldn't talk about it. It was you didn't want anyone to know you had it. It was really an embarrassing topic. God forbid you had any blood leaking or anything like that. But I feel like now we're at a point where people own it. People know that there are others menstruating around them all the time, and it's no big deal. Not that you want to leak or anything, but it's not as big of a deal to say that you're menstruating at the time, right? And so I feel like that same mindset can be applied to incontinence, where it's common. A lot of times it's treatable, but it also is not something that should be so humiliating. In the male space, I feel like there's nothing equivalent in the sense that because it's less common in men, it's that much more stigmatized, that much more not talked about, and then that much more unaddressed. So I didn't feel like men had really any good options out there. All the options pretty much made you look like an old man. And then of all the underwear of the people who were making something sort of acceptable, they weren't using any new technologies. So, you can make fabric really absorbent. So fabric can be super absorbent, but you can have the most absorbent core. But if the edges are not, or if you're using, I want to say suture, but if you're stitching, any fluid will just seep through the edges. And so all the male options, even if they had a potential for high capacity, it never actually did, because it would just seep around. So nothing could actually hold what they said it could hold. Similar in the women's space, I thought a lot of the period underwear, for a couple of there were some period when I started, there were some they just had started launching, just became period underwear just came into the awareness of the public. The viscosity of blood and urine is so different that the amount of urine that those period underwears could hold were just, a table, like just a teaspoon and they would leak through. And similarly, there were so many new technologies in textiles that wasn't applied to it. So although you could have some absorbency, it didn't have the true leak-proof ability. And then finally, positionally, it's a little bit different, just because the vaginal opening is a little, they tended to miss where the urethra is. So I felt like where the location of where the pads wasn't ideal. If you used it for an alternative purpose, it wasn't optimized for that secondary purpose. So I wanted to make something that was dedicated just mainly for people who are going through, people with leakage, but I wanted it to look like underwear you would wear anyway, underwear you would buy, and it just happens to be leak proof as well. I feel like once I get it into somebody's hands, then I like I feel like once they have it, it's not uncommon. People will buy one and then they'll come by and buy 5 the next order. I do, there was a learning curve to this. So in my first production run, I didn't realize all the steps that you needed to take to make sure all the fit was correct and size, did it scale appropriately. So on my first production run, especially as it scaled larger, it didn't convey. So everything was scaled to me because I tried everything on. And so unfortunately that doesn't scale appropriately. And so, so I've gotten the fit a lot better. And so the feedback's been really great. And, I have a lot of friends and family that exclusively just wear my underwear as a daily underwear. I try to use more eco-friendly processes. A lot of as a physician, you're always worried about antibiotic resistances, and most of the time the odor resistance and all these treatments people put on the textiles are some sort of antibiotic-based treatments. And so I try to pick fabrics that were naturally antimicrobial, so that the number of you didn't have so many chemical treatments to it. And I am sort of try to be eco-conscious as much as I can be, and I don't want to contribute to the microplastics of the world, and or the waste, and that all the pads and that the incontinence, and just diapering a kid, you're just throwing out bales and bales of trash every day. It just breaks your heart, what you're doing to the environment, right?